Hi, this is EdwardCTracey, and I'm here in Vigo County, Indiana, and I flew into Indianapolis. So how far from Indianapolis is Vigo County?
About 75 miles west.
About 75 miles west of Indianapolis. So it's not exactly a suburb of Indianapolis. I guess the big city here is in Vigo County, is
Terre Haute.
Terre Haute. And so today we're spending the day in Vigo County, but we're here for a purpose. We're here to talk about access to healthcare. And I found a model through friends back in Georgia that are here living in Indiana. Friend Dr. Patel. And Dr. Patel has started a great model here. He was a managing executive for hospitals, for emergency rooms. He spent a lot of time treating patients and knowing the ups and downs of emergency care and trying to find a new model. He got together with some of his friends and they started this new healthcare model. And I have Christy Lee here who works for Dr. Patel, and she's part of this great organization. And I also have here Sheriff Greg Ewing, and the sheriff is here to talk to us about how it's helping his organization. And so we'll start off a little bit with Christy giving us just a little intro as to how the relationship with the Sheriff's Department started, and tell us a little bit about the company and all of that.
Absolutely. Well, I'm Christy Lee with Advocating Health, and probably almost a year and a half, almost 2 years ago, Sheriff Ewing and his jail commander at the time, John Motes, came to Dr. Patel and I and said, you know, we hear all these great things you're doing for the school corporation, and the school corporation is actually a clinic that we manage for their employees. Primary care, urgent care, those types of wellness situations. So Dr. Patel and I kind of thought about it for a minute, and we thought, wow, we've never been inside of a jail, so we'll start there. So we took a tour and got to know their system and thought, wow, we could really save a lot of money here, manage it, take a lot of the liability off of the correctional officers, because at that time, the correctional officers passed medications to the inmates in the evenings, and that was something the sheriff wasn't comfortable with and knew that if it ever was an issue, it would come on him. So we came in as the management group and took away all of that liability from the sheriff, and in turn we have a nurse that's on staff 16 hours a day at this time, so all medication passes are covered by a provider. We have a nurse practitioner, physician assistant, or a physician 7 days a week for around an hour to 2 hours a day, depending on the med call list for the inmates. As well as, you know, the more we got into it, the more we realized that we could do in-house. So now we do suturing if there's, you know, fights and lacerations that happen. We have a 12 lead, so that if an inmate says, I have chest pain, we can, you know, see what's going on. We can also do IV fluids, antibiotics, and those types of things. And I think, you know, the main thing that we wanted to focus on was, you know, we were used to building relationships and wellness clinics and, you know, that type of thing. So initially when we went into the jail, we thought, gosh, we probably should hire like a military guy to, you know, kind of be able to have control of these inmates. But what we realized was we had to fire all those people that we hired in the first week because they were not what we needed. So we found a staff that we put there, that it's a staff that we can put in any of our clinics. And the key thing to that is that the inmates then relate to these people, they trust them, because otherwise the inmate has more rights than you and I. If they say take me out and they don't and something happens, it's a catastrophic event. So they normally would have to take them out. And now, since we've been there in the last year, the transport outside of the jail is just way down.
Well, that's a good point, Sheriff, to talk about, because transportation is expensive, requires a lot of staff.
Correct.
And you have to make sure the hospital facility is secure, all of those things. How in your world has this just benefited the jail and your department?
Well, because typically we are understaffed and you know, you never have the people that you feel you need to actually run a facility appropriately, and that's true across the United States. This has really been a win-win, and just like Christy was saying, we very rarely have to take somebody to the hospital now, because there's so many things that they can now do in-house, which is the same type of services they would receive in the hospital ER. And with inmates, you know, they're always trying to pull a fast one. They don't like the mat that we give them. They want to be in a comfy bed and cable TV and different meals. You know, they don't care for any of that stuff that they get at the jail. So, you know, you would have a lot of people that would fake some type of symptoms. Chest pains were the most common, and of course that required some physician to, you know.
And you
hook
couldn't
'em up.
because
You
you
can't
could be
ignore it.
liable
Because
something
if you
was real.
had, and it was true, and they died, I would be responsible. And so the liability was tremendous, and so we had no choice back then was to send them to the hospital. Well, now, since we have Dr. Patel's group in there, that a lot of the stuff, the EKGs and the blood work and all that is being done right there at the jail. Nobody leaves secure facility. I don't have to send 2 officers to man that prisoner for security purposes. You know, it's a huge safety issue, taking them out of the jail, especially depending on their crime, and a safety issue for the officers. You know, you don't know if somebody's made a phone call and planned an
Right.
ambush or something like that, so you always have to be thinking about that. Anytime somebody is leaving the facility, whether it's a planned event or whether there is actually a physical reason for their medical condition, but it's been a tremendous savings because we just don't have the manpower.
Right.
And you know, that if you look at the man hours we were spending outside the facility, you know, it just made us short somewhere else. So it's been win-win. And just on that regard, you know, suturing right there at the facility. Now I'm sure the inmates don't like it because they don't get to go out and sleep in the comfy bed and their own cable TV.
And when you have that call for chest pain, what happens now?
Well, what happens now is, of course, my staff immediately alerts the medical staff, and that's 24/7. You know, they'll send somebody in if it's when we don't have a staff person there. We staff at 16 hours currently, but because things are working out well and our costs have been kept down, we're actually looking to increase 24-hour coverage for our facility. So now what happens is we don't get very many chest pains because they know they're not going anywhere, and if they do, the staff takes care of it.
So in the clinic has the equipment to handle how many things that normally would go to the emergency room, Christy?
I think there's quite a few things. One, like Sheriff Ewing said, chest pain, we can determine if it's a true episode. The other thing that...
Because you have an EKG machine.
Right, exactly. We have a provider, you know, read it. And the other thing, the officers, the correction officers, they're not having to make medical decisions. Before, they had to decide, well, they're going to always decide to take them out because that's just too much of a responsibility. And now they pick up the phone and they have someone that counsels them to say, in those few hours that we aren't there. Another thing that was a big thing when we first came in were the diabetics. Nobody really managed the diabetics. And we had some onset diabetics that, you know, were diagnosed inside the jail. They'd never been given education, so of course they weren't eating right and they didn't understand. And so that's another piece. You know, now the diabetics all, you know, have the same process and they receive education if they're diagnosed.
Nutrition
in-house.
education.
They do.
And does the staff understand nutrition education when they're serving meals and all of that? Well, that's great. There's another side to this. We're taking care of the inmates, and everybody will say, well, that's good. The inmates are getting some great care. What about the guys that are actually there working? How do you care for them? And you are also part of the county program.
Part of the county clinic, yes. They are county employees, and so they're entitled to the county clinic. And you know, it's from a management standpoint, it really works out well because usually if they need to see somebody at the clinic, they can call and they're in within a matter of a few hours. And what I do, perhaps maybe is a little bit different than other departments or offices in county government, is if they need to go see them, I don't have them account for that absence while they're going down to the county clinic to be seen, because here's my thought on that. If they can go down there and get that taken care of, If they'd had to go on somewhere else, they'd have probably taken a whole day off. And I just told you, I don't have the staff that we can just have the luxury of everybody being out. So as a benefit for them to use the county clinic, you know, your appointment's at 10 o'clock, run on down there. You know, it's not gonna cost you any of your time.
And you know it'll only be 20, 30 minutes, because
20
they're
or
not
30
waiting
minutes.
in the waiting room.
Absolutely, they're gonna get them in and get them back, and they're gonna come back and complete their job and whatever, you know, they've determined, medication or whatever.
The medication's right there, they take
Right.
it when they leave.
Well, that's great. How about yourself? Are you on the plan yourself?
Absolutely, me, my wife, and my 3 children.
Have you
And,
had an opportunity to use it yet, or unfortunately, if you did?
Yeah, and I'll tell you, yes, I have. You know, this sinus cold and congestion went down there, got right in. You know, came out with medication. But here is the best thing about this. My job obviously gives me high blood pressure, and I've got a little bit of high cholesterol. Okay, well, that was medication I was getting at a local pharmacy and having to pay a copay. I went down there, they reviewed it, did labs, everything that my regular physician that I have had did, and now I go down there and I walk out of there paying $0 for the medication I was paying at a minimum $20, sometimes $30.
And no copay for seeing the doctor.
And no copay for seeing the doctor. Yeah.
So, retention's a hard thing on a police force, sheriff's department. Do you think that gives you an advantage over your counterparts in other areas where now your officers say, you know what, I've got this great benefit. It's like getting a pay raise every year because, you know, I'm able to keep $1,000 a year from not having all these copays.
One of my deputies walked in and he said, I've got to go see my doctor. I've got this cold and this and that. And I said, you're on the county insurance, right? Yeah. I said, go down to the clinic. I said, give them a call. I said, they'll be able to get you right in. I said, and any medications you take? I said, I don't pay anything. I said, you're crazy. And since has walked in paying $0, walked out paying $0.
Wow. And
So-
back to work right now.
And back to work.
Which for you
Which
is very
great.
important.
Yes.
Well, that's great. I appreciate that you taking the time to sit down and talk to us, and we just are glad that you're excited about it. I'm going to share this with the people back in Georgia,
Fantastic.
and we wanted to get real life testimony to bring back there because healthcare costs are rising all for everyone, and especially in these times when tax dollars are not growing at the rate they once were. There's got to be ways to cut budgets and keep people healthy at the same time.
That's right. That's
So,
right. Absolutely.
Did you have to share anything else?
Just one more thing, you know, when we're talking about inmates, this is the first year. Now, this is my 2nd year in office as the sheriff. This is the first year that we have not had to go back to our county council and request additional appropriations in our medical line item.
Wow.
You know, it used to run us almost $2 million for roughly 270 inmates. So we are seeing, and my council loves it, because nobody wants to spend that money for inmates, although there are things we have to do by law. So the plus is we're holding the cost down, which is your taxpayers' money in your state, my taxpayers' money in my county.
Right. Well, that's a great testimony, and we appreciate your time taking out of your day to come here and sit down with us and let other people know.
Great, thank you.
Thank you, Sheriff.
Appreciate it.